Today I'll be breaking down a very important pathway in pharmacology and its physiology, the arachidonic acid pathway. Have you ever wondered how fatty acid can actually play an important role in pain, in inflammation, and even in protection? I'll be talking today about the arachidonic acid, and I'll be explaining the pathway and also the drugs that inhibit certain enzymes in the pathway. So now we know that arachidonic acid is a 20 carbon unsaturated fatty acid, polyunsaturated fatty acid that is stored in the the membrane phospholipid of the cell. And when this arachidonic acid is released, enzymes break it down and, of course, get it into action. So now I'll be looking at first at the membrane phospholipids. The membrane phospholipids is being broken down into arachidonic acid by the enzyme PLA2, that's phospholipase A2. Phospholipase A2, right, hydrolyze the membrane phospholipids to release AA, arachidonic acid. When arachidonic acid is being released, it cannot proceed to form other mediators that are responsible for pain, for protection, and the likes. Now, phospholipase A2 is being inhibited by steroids. So it is being inhibited by corticosteroids. I'll just put that here, steroids, to maximize my space. It is being inhibited by steroids such as methylprednisolone, hydrocortisone, and other cortisone. These steroids blocks the synthesis of arachidonic acid and blocks the inflammatory pathway entirely. It has broad spectrum of activity. Now, arachidonic acid is now further metabolized, or it is now further hydrolyzed into prostaglandins, prostacyclins, I'll call that PC, or I'll just say PGI, and tropoxane A2, TXA, tropoxane A2. It is being metabolized or synthesized from arachidonic acid by the enzyme COX, otherwise known as cyclooxygenase. Cyclooxygenase enzyme are basically of two types. We have the COX-1, we have the COX-2. COX-1 is for protection. It's always available. It's for protection. It protects the mucosal lining, the stomach lining. It regulates renal function in the kidney, and also very, very important for the regulation of blood flow or maintenance of vascular tone. Now, COX-1 is for protection. COX-2, however, is inducible. That means it is induced during pain and inflammation. COX-2 is for inflammation. Now, the COX enzymes are inhibited, whether COX-1 or COX-2, generally by the NSAIDs. So it is blocked or inhibited by the NSAIDs. NSAIDs are the non-steroidal anti-inflammatory drugs such as aspirin, indomethacin, ibuprofen, diclofenac, and the likes. But though we have some selective NSAIDs such as celecoxib that only inhibit COX-2 and not COX-1. Now, of course, when these COX enzymes are being inhibited, inflammatory mediators such as prostaglandins, prostacyclins, and tropoxane A2 would not be produced. Prostaglandins are responsible for pain, inflammation, for fever. Prostacyclins is responsible for vasodilation, for inhibition of platelet aggregation, while tropoxane A2, which we all know that is an important platelets aggregating factor, is responsible for platelet aggregation and vasoconstriction. Now, arachidonic acid is also metabolized by LOX, 5-lipoxygenase, into leukotrienes. Leukotrienes I would call LTS. Leukotrienes is very, very important as modulators of inflammation. It causes bronchodilation in bronchial walls of the lungs. And leukotrienes, basically, their receptors are blocked by leukotrienes inhibitors, such as those seen in chronic obstructive pulmonary disease. We use the drug, the LTS inhibitors, such as, so they are being inhibited or blocked by Montelukast, or I think Zephyrlukast. They are being inhibited by these two drugs, and of course, there are also drugs that inhibit the LOX enzymes.